One of my passions is to make sure that patients that I have looked after for so many years have a safe journey through this medical maze and the hospital system. So one of my ideals is to really make sure that we have capacity for these people to have a background of safe medical records, and for those medical records to transition through the medical system in an efficient way. So when secure messaging and My Health Record came on, I embraced it passionately.
I'm experienced with digital health technology and what it can bring to good care outcomes and quality care outcomes for people, and most importantly, greater choices and greater controls to residents when they live here with us. As people age, more and more practitioners are involved in their care and services, and it's really important for them that they have accuracy of information, but it's for all consumers of health services within community as well as residential care.
The main method of communication we have at the moment is just via fax, which is pretty archaic, and occasionally via phone, and that's very subject to human error. The reason why we're transitioning to My Health Record is because we want to be able to give our patients the best care possible. By having access to this, all of their potential allergies, their history, we're able to fully identify any interactions or any contraindications that are possible and really give them the best care possible.
The best thing about My Health Record is that we can see information from other areas. We look and see what's happening with the GP, if the GP's uploaded a health summary. It's great when they come into ED. If they have come from different areas, you can see what medications they're on, if they've been updated, what happened in their last presentation to another facility. We can talk to other health providers in real time to consult with and collaborate with.
It has opened a channel that you know that there are other practitioners involved in this patient's care, and it becomes a teamwork then, instead of people working in silos and trying to understand who else is involved. I think it is a lot more coordinated care.
Statistics show that when you go to an electronic platform, the error rate is reduced. I think our families and our residents will be greatly comforted by that.
Simple things like when they go to another practitioner, they have to give the full details, tell the whole story again. Sometimes they get really anxious that don't you already know?
Patients love it. I've had absolutely no resistance whatsoever from my patients, their families. They're quite delighted that the burden of having to manage medical records, safe medication management has been mapped out for them.
For example, if a patient's on warfarin, we can view their INR results, and if we see that there's a disconnect between their warfarin dose and their INR results, we can liaise directly with the doctor about that and really optimise their therapy.
The more people that get on board, the more information we can actually upload onto these platforms. We can now look for blood results, we can look for radiology, we can look for doctor's letters, we can look for hospital transfer letters, discharge letters. Everything that you really need to know about your patient, and that's safer for the patient, and it's safer for you as a clinician.
We use a platform for secure messaging to communicate with other healthcare providers, and it has just eliminated the need for fax machines, emails.
To find out more, to learn more about it, to engage with digital technologies, I strongly encourage people to contact their local health network, in our case, the Sydney North Primary Health Network.
Look at what you're doing in your private life and think how much safer and how much quicker it is if we do it in our work life as well. And we can do it in a professional way. And get everybody using the system which is designed to support the whole of the health service and ultimately benefit patients.